we have to offer all extractions of bone graft on the extraction site. I don't support that all extractions get bone grafted. There should be a reason and a purpose, or the money doesn't get spent well on the bone grafting. We do offer it at any place where you can still get an implant in, or if you don't place the bone graft, you won't ever get an implant in, okay? I.e. tooth number 14, tooth number 13, tooth number 12, those upper posterior teeth. If we pull a tooth and we don't do a bone graft, somebody may not be able to get a bone graft later, and they may not be able to get an implant. So I kind of do that. I think all canines need to have bone grafts. All first molars need to have bone grafts because those are important teeth, and we can build things off of them. So anyways, by law, we have to offer bone grafting to everybody on an extraction. The extraction form, you accept or decline, or at least you sign something saying that you've been explained the benefits of a bone graft. Benefits of a bone graft are, the immediate benefit is that you have very little postoperative pain. It decreases postoperative pain significantly, not a little bit, drastically different. And it promotes healing much faster, and it promotes better healing. You end up with a bunch of bone instead of a hole in your mouth. So it's there's good benefits for it. And the reason that we are now by law having to offer bone grafts has to do with tooth replacement. So and that's implants, okay? So that's why the law, people got sued, dentists were being sued because they didn't offer bone grafting at the time of extraction, and then people lost the opportunity to have an implant there. So then it became usual and customary, and we have to abide by that, that we offer bone grafts, and it's for tooth replacement. Okay, so we try to use cortical demineralized human bone. So we are using real bone. It's demineralized. That means all the biological materials are taken out, so it's not, it doesn't have a chance to present disease, which is good. It's dehydrated, and we rehydrate it with articaine, and that's a big deal for patient comfort because we use articaine in rehydration. That means when we're packing the bone into the socket, we're carrying articaine into the socket, and it's staying there long term in a very condensed fashion in the bone, and it just decreases people's discomfort drastically. So generally after a bone graft, pain medicine is still given. The prescriptions for this procedure for extractions is the same for bone grafting. The prescription sequence is 500 milligrams of cephalexin, QID 4 times a day, take 4 times a day, and take 2 stat. So we still give the cephalexin. We do hydrocodone, 325s, 16 tabs. Take 1 to 2 tabs every 4 to 6 hours as needed for pain. But we find with our extractions and our bone grafting, most of the time people only have to do that the first day. If they sleep through the night, they're welcome to use ibuprofen and Tylenol. If you take the two together in doses up to 800 milligrams of ibuprofen, 500 milligrams of Tylenol, you really can have no discomfort. It'll take care of your pain, and you have a minimal amount of narcotic in your body. And then the third prescription that goes with this is chlorhexidine. We give 1 bottle of chlorhexidine. We rinse morning and evening twice a day. The instructions on the bottle are for 30 seconds. And we wait 2 days. The day of the surgery is day 1, we do not use chlorhexidine, and day 2, we don't use chlorhexidine, and day 3, we do. It has something to do with slowing down primary healing. So, and it promotes secondary healing. So that's the why, if somebody was interested in why do we wait 2 days. Chlorhexidine is an antibiotic, and it really cleans up people's gums and tissues, and it does promote secondary healing, and they heal really fast. It's not uncommon for us to get a bone graft back in 7 to 10 days, do suture removal, and it will be healed. It'll be closed up and healed, and it'll look good. So it won't do that with a smoker, and it won't do that with a drinker or a diabetic, maybe, but it does for the average person. This is a good regimen, and people heal quickly and painlessly on it. Okay, other than that, the procedure is the same as any extraction. So our first job on the bone grafting is to get them numb, profoundly numb, and then to extract the tooth. After we extract the tooth, we try to do that as non-traumatically as possible, i.e. if we can get it out without using a drill, we prefer to do that. Drill just causes bone necrosis. So we do try hard to get it out without a drill and stuff, but when it's okay if we have to get it out with a drill, we use a drill. We use a special drill on surgeries, just so you guys know. It's just a surgical drill. The air comes out the back of the handpiece instead of going into the socket, and it's the approved drill for using on surgical sites. It stops you from getting air embolisms.